I'm Susan Luck. I live in Miami, Florida. I'm adjunct faculty at the University of Miami in their clinical nutrition program. And I'm the co-director of the International Nurse Coach Association and faculty in our Integrative Nurse Coach program. So had the opportunity to work as a nurse in an emergency situation after an earthquake in the highlands of Guatemala. And I saw a system of health and healing quite different from the one that I was living in, which was as a med-surg nurse at a big medical center in New York City. And it exposed me to other possibilities for healing, for family, for community. And it led me on a search both to become a community health, public health nurse, and to study anthropology to learn other systems of healing. I remember sitting to want to understand in a clinic with Mayan women who were holding eggs and candles and incense and praying. And I sat there as a Westerner with some Western problem in the moment. And I remember reflecting, I'm sitting here as a Westerner. This is not my belief system. Will this have the same impact going into that shaman's office or healing room as for the women who are steeped in this cultural world and belief? And it was just the question. And how much and facilitates the healing process based on our beliefs. I think the cultural piece for me is really where it's embedded in people's cells, spirit, their cultural models that they grow up with, whether it's around food, healing modalities that maybe their grandmothers brought to the family tradition that it carried down. And I think that when we're looking at healing and whole person systems, the cultural piece is really essential for mobilizing those healing forces within. It allows a great opportunity to sit with that person and really listen to their story. And that's really the art of nurse coaching, is really the patient, client, family narrative. And it goes back to culture again. Who are you? You know, what do you believe in? They're so used to coming into a medical model where they're told, this is what you need, here's the prescriptive, take this list and follow it. And we know that that doesn't work. 60% of diabetics who do a diabetic education class revert back to old patterns and behaviors, so something isn't working. And a bigger belief in transforming healthcare is that nurse coaching and integrative nurse coaching could be a transformative moment for both the nurse, the patient, and healthcare. What I say is, imagine if all of us were involved in this transformation, how we will really be the nightingales of the 21st century, if you will. And I could say that in our program, we have nurses who have come from New Zealand who are bringing it back. And I see that there's interest everywhere because nursing is really, the common thread in nursing is that we are a caring profession who really our intention is to help others. And so beyond maybe the languages and some of the barriers that we all experience, there's this commonality. And this conference epitomizes that, of bringing together nurses and nursing leaders from many countries. And I think this is just the beginning.